I suppose there were two main findings. One was that practices weren't all aware of how to deal with people who are vulnerable and obviously have no fixed abode. And the second one was that where it was working well, it was working extremely well. And as a result, we were recommending to the sort of CCG stroke Integrated Care Board that it considers rolling this service out across Norfolk. The old city reach that this is taken over from was also incredibly well received by vulnerable adults, and it's a service I've visited many times and was amazed at the standard of compassion and care that was quite rightly given to these patients who frequently didn't know where else to turn. And it wasn't just health advice that they were providing, there were a whole range of other sort of spin-offs that came as a result of being able to deal with such a group, really.
Vulnerable adult service is basically it's a GP practice, but it's a GP practice that we feel is much more inclusive than perhaps other practices might be. So we know that certainly inclusion health groups, which the definition for that is people that for whatever reasons may not have a permanent address, they may have complex health needs, they may be homeless living in a hostel, maybe from the gypsy and traveller community potentially, or a forced migrant. And sometimes accessing mainstream surgery services isn't always that easy. So we are a primary care provider to provide that kind of health care, to link people in and support them with their kind of complex health needs and care needs that they may have. So certainly, generally people that come to our service may be referred through another organisation, such as one of the hostel providers, for instance, in Norwich, maybe when they're released from prison, and they will know from maybe support workers that we're a service that exists and can give them that support. So one thing we have that mainstream surgeries don't have is we do have support workers that can support our patients. And we do have an inclusive way of working with people so that our appointment times, for instance, are longer, they're more flexible, and the environment is quite different, I think, to what you would find in a mainstream general practice. We do have a variety of means of kind of offering appointments to people, such as the telephone and face-to-faces and virtual, but that's not very often because many of our patients really don't have the digital means to do, virtual consultations. And certainly what we do is we support people to attend those appointments. Our support workers, for instance, will meet somebody and walk with them to our clinics here, or be at an appointment at the hospital. They'll offer that support to attend hospital appointments, for instance. So it's a very kind of holistic, patient-focused, centred service provision, but we provide all the primary care elements that a mainstream general practice would do. I think often when you go to register a practice, that in itself can be quite intimidating. There's a lot of paperwork to fill out. It's somewhere quite strange, but I think often, our GPs here and certainly our admin staff and our support workers have been working with, more vulnerable communities for a long time and kind of understand those kind of skills that we need to have in order to make people feel welcome and not judged at all in any way, and supported to kind of fill out that paperwork and register at the surgery and to attend an appointment. I mean, in Norwich we're very lucky. We have what we call the Vulnerable Adult Service as a hub, an inclusion hub. And the kind of the idea of the model and how the concept works is that people won't be here with us forever. Ideally, it may be in 6 months' time, potentially longer than that, they can be supported to move on to a practice that's closer to where they're living, when their accommodation is more stable and their lives are more stable. And in Norwich, we're very lucky that we have inclusion health practices as well. So again, they offer that more holistic, patient-centred approach to the care they're providing. We'll have a named clinical lead in the surgery. And actually, we can support them as well because we still link with those practices as well. So there is that continuity. As part of our team here is crucial, we have an integrated care coordinator who's employed by Norfolk County Council, who has access to all the social care systems, which is called Liquid Logic, as well as our system-wide health system, and also Lorenzo, the mental health system. So we can really track and coordinate and support our patients in their care across different sectors, I think, which is important. We work very closely with Change, Grow, Live, which is the substance misuse service provider for Norfolk. And again, they attend weekly meetings with us, so we can really put that package of care around our patients. And essentially, we also work very closely with the Pathways team, which is a St Martin's team, which is a combination of many services working with the homeless community in Norwich. And essentially to that, there are outreach workers that are nurses from the Mental Health Trust, and we work very closely with the Pathways team as well. So it can be a very joined up approach. I've seen patients that go on to, move into accommodation, and sometimes that can be very challenging, but we've seen patients where that works really well and they end up in accommodation with a tenancy and a supporter, which is fantastic. But we do know that certainly some of our patients with very complex need, they'll need a really good support package around that to maintain that tenancy. And one of the approaches that's been taken across Norwich is housing first, where Norwich City Council will house somebody. We will remain obviously their GP, but there'll be a whole package of support around that person. And that can be challenging because clearly people will have complex needs, but we're very much linked into that. And that needs to develop further. But I think that's a really, really important aspect, that people have accommodation and somewhere safe to stay. I mean, the current pilot is a model. I think certainly looking at how general practice can be more inclusive is really important, and we hope that many practices will become inclusion friendly, and some will obviously provide more of a service. If they've got a hostel that's close to where their practice is, then we hope they can support that hostel as well. That's what it's about, that people can register and feel welcomed and cared for wherever they want to register, because that's their person's choice.